This is Animal Testing for Research Purposes: The Ethics, Impacts, and Alternatives of the Practice. Animal testing for research purposes is a socio-scientific issue that is very controversial. Thanks to animal testing, many advancements in medical treatments have been made possible, and we have a lot more knowledge about genetics, disease progression, and biology as a whole. But is it worth the harm to animals? This presentation will study the impacts of animal testing in medicine and society at large. We will argue whether or not it is ethical by using the 5 pillars of biomedical ethics. The benefits of animal testing will be explained, as well as the drawbacks, and we will present possible alternatives. What is biomedical ethics? Defined by the University of Iowa as the study of the moral, social, and political problems that arise out of the biology and life sciences. The 5 pillars of biomedical ethics are autonomy, utility, justice, non-maleficence, and beneficence. It is important to know that each pillar is weighed with equal importance. If one is not honored by the practice of animal testing, that does not automatically mean that animal testing is declared unethical. But by carefully weighing the pros and cons of honoring or dishonoring each pillar, we can judge if the practice is ethical or not. Autonomy. Defined as the ability to direct one's own life and choose for oneself, respecting autonomy is about honoring one's right to make their own rational decisions and judgments about their own life. Where people are concerned, this includes informed consent and confidentiality, as well as examples such as letting a patient choose their own care plan or letting them choose not to have surgery. But where animals are concerned, they are not able to give explicit consent to participate in experiments, and their overall sentience is questioned. So because of animals' inability to be properly informed of their rights and to give consent to research participation, the pillar of autonomy is not honored. Utility states that we should produce the most favorable balance of good over bad, or benefit over harm for all concerned. The philosophy of utilitarianism focuses on outcomes, that the most ethical choice is the one that will produce the greatest good for the greatest number. This rejects speciesism and animal exploitation, declaring that all species are valued equally. Utilitarianism also requires consideration of future animal lives that are at stake. We know that for research, animals are harmed during transportation, breeding practices, as well as before, during, and after experimentation. So according to the philosophy, the harm to current and future animals is greater than the positive outcomes for humans, so the pillar of utility is not honored. Justice. Defined as the fair, equitable, and appropriate treatment of persons, justice is often used to describe punishments, or as Aristotle said, giving to each that which is his due. This is difficult to assess for the case of animals because they are not chosen for experiments based on bad behavior or because they deserve it. Now, a core principle of the pillar is that equals should be treated equally. So for a practical application of justice, all animals in a certain experiment should be subjected to equitable treatments, the same living quarters, same nutrition, etc., as ensured by the IACUC, which will be explained later. But if all species are created equally, as utilitarianism says, animals do not have justice compared to humans, so the pillar of justice is not honored. Non-maleficence. This is defined as the obligation of a physician not to harm the patient, whether it's intentional or not. A few basic rules are to not kill, cause pain or suffering, incapacitate, cause offense, or deprive others of the goods of life. The Institutional Animal Care and Use Committee, or IACUC, was established in 1985 with the purpose of protecting animals used in research. Every research department that involves animals must have one. Some of their responsibilities include inspecting animal facilities, approving experiments, and shutting down unethical or unnecessary experiments. And to achieve this, they enforce the 3 R's of animal use alternatives. Reduction aims to minimize the number of animals used as much as possible. Replacement states to substitute animals with non-animal methods, and refinement states to use techniques that reduce pain and distress. So while there are measures being taken to honor the pillar of non-maleficence for animals used in research, using animals in experiments at all goes against the principle. So this pillar is not honored. And finally, beneficence states that we should do good to others. Similar to non-maleficence, it attempts to prevent or remove harm, but while actively promoting the well-being of others. So in animal testing, there isn't exactly any beneficence toward the animals. So every year, more than 110 million animals are killed in US laboratories alone. But instead, there is beneficence toward the humans that benefit from the animal sacrifices. Some breakthroughs in human medicine as a result of animal research include vaccines, organ transplants, and MRI imaging. So the pillar of beneficence is honored in relation to humans, but not to animals. So based on all of this information, we can determine that using animals for scientific research is not ethical.
Slide 9, medical advancements. Animal research has contributed to major medical advancements. NIH states it has helped improve disease prevention, detection, and treatment. Examples include insulin, penicillin, polio vaccine, blood transfusions, and treatments for cancer and epilepsy. So animal testing has helped scientists develop many life-saving treatments and medicines. It raises major ethical concerns, but it has also played a very important role in helping advance human health. Public health concerns, or public health contributions. Animal research supported the development of the polio vaccine. NIH identifies the polio vaccine as a major advancement linked to animal research. CDC reports global polio vaccination has saved over 1.5 million lives and prevented millions of paralysis cases. Animals are needed in research to develop drugs and medical procedures to treat diseases. Former NIH Director Francis Collins. So the polio vaccine is a strong example of how animal research has benefited or benefit the public health. It demonstrates that medical research can have a positive impact on millions of people. The ethical importance of the benefits. Animal research relates to the benefits, ooh, beneficence, doing good, and utility, the greatest benefit for the greatest number. It has contributed to important medical discoveries and improved public health. Benefits should always be weighed against animal welfare concerns. Animal testing is not automatically ethical just because it helps people. Scientists must balance the medical benefits with the responsibility to minimize harm to animals. Alternatives to animal research. Alternatives include cell cultures, organs on a chip, computer models, stem cells, and clinical research. These methods help reduce and refine animal use. NIH states that they cannot yet fully replace animal research because they cannot replicate every aspect of the human body. Alternative methods are becoming more advanced and help reduce harm to animals. However, they are not able to replace animal research in every area yet.
Animal suffering and ethics. Animal testing has contributed to many scientific discoveries, but it also creates ethical concerns. Animals used in experiments can experience pain, stress, and suffering from procedures such as surgeries, injections, or even being exposed to disease. Since animals could not choose whether they can participate in these experiments, many people question whether it's morally acceptable to use them for research. This raises a important debate. Even if animal testing can benefit humans, should those benefits come at the cost of animal suffering? If you can go back for me, please.
Oh, my bad.
So sorry.
Is it this slide? Okay, it's this slide.
Perfect. Animal testing results are not always accurate for humans. Another concern with animal testing is the results do not always translate perfectly to humans. Although animals and humans share some biological similarities, our bodies can react differently to medications and treatment. Some drugs that appear successful in animals may later fail in human trials or cause unexpected side effects. This shows that animal studies can provide useful information, but they do not always accurately predict humans' outcomes. alternative cell and computer-based testing. Because of the concerns surrounding animal testing, scientists have been developing alternative methods. Researchers can now use human cells grown in laboratories and computer based models to study diseases and test possible treatments. These approaches can reduce the need for animals, save time and resources, and may provide results that better represent how the human body responds. As technology continues to improve, these alternatives may become an important part of future medical research. Thank you.
All right, well, that's it. Go here and stop.